you. This has been a marvelous and rich day of discussion, questions, commentaries. I want to add my thanks also to all of our panelists, as well as especially our moderators who exercise such discipline on the part of everyone to keep us very much on time, and I thank you very much for that. I beg the forgiveness of those who wish still to raise questions and offer comments, and hope that we'll have an opportunity still to carry on this discussion. It's evident, I think, to all of us that we barely scratch the surface of so many of these topics. We certainly have not exhausted the very important issues that we have tried to come to grips with on transforming health professional education. We've talked about the domestic and the global dimensions. We've raised implications for institutions, for whole professions, for people who care about pedagogy, and for those who look at system requirements to enable an effective healthcare system that is coupled with the educational system that provides the human infrastructure to make that system deliver the care that we know we want to deliver to our patients. I'd like to just close with a few observations. The first is that we have raised many critical dynamic forces that are drastically changing our system. Complexity, cost, the demands of new information, the demographic and epidemiologic transitions, all of these and more impose change on the environment in which we operate and give care. In a dynamically changing environment, standing still guarantees that you will fall behind. So we don't have a choice to stay where we are. The problem is that there are so many ways to change that might make us in an even worse situation. And we have to be able to discern those types of change and act on them that will improve our capacity to meet where the system is going, not where it is, but where it is going. Wayne Gretzky had it right. Skate to where the puck will be. That brings me to the second point. We cannot avoid the necessity for prediction. We're going to be making predictions about how the system will change, how education will change, how pedagogical methods will transform. And all of these predictions we have to work on to converge with decisions that are made today that will have effect only in 10 or 20 or 30 years. What we do today to affect the education of our newly minted health professionals will be evidenced in the care they deliver in 10 and 20 years. And so we have a double dilemma in the prediction. We have to both predict how the system will change, and we have to be able to manage and predict how the human resources will adapt and be able to change to meet that system. This means, in reality, that we have to be very modest about our degree of confidence as to how we're going to change. Now, if you couple that modesty with the necessity to act, it means we're going to have to reconcile an honest sense of how hard the problem is with a determination, nevertheless, to make choices and to move. And one of the richness and diversity of our nation, in which we don't have to impose the identical solution even on Stanford and UCSF, never mind if we move outside of California, is that we can do some experimentation. We can try different things. We can see and learn from one another, but this implies a capacity which we are not particularly good at, which is learning from and acting upon the learnings of others. We often celebrate the innovators. I think we need to celebrate the effective adopters. We need to celebrate those who are able to look around and say, we have picked the very best of the experience and accomplishment of each of 8 institutions, and we've improved on all of them. And here's how we did it, and here's how you can do it the same way that we did it. So we're going to need to have a modesty and a determination, and we're going to have to be able to adapt and learn from one another. We're going to have to be able to think about the educational process, not only about the core education of our emerging health professionals, but as a number of questioners and commentaries pointed out, we have to think about the pre-professional period, and we have to think about the lifelong learning obligations of health professionals all at the same time. Because that educational transformation that we need is not simply about undergraduate health education, whether in nursing or pharmacy or social work or medicine or any of the professions. It's about preparing individuals for lifelong adaptation and learning. Teams. If we don't have effective teams in practice, it's very hard to teach effective teamwork. If we don't teach effective teamwork, how are people going to learn to work in practice? It's a cycle. We have to figure out how to break in on it in both dimensions. We have to both practice in teams, and we have to be able to prepare people to work in teams, and we can't wait for the one in order to do the other. But if we manage to do both, they will be mutually reinforcing. We do have to evaluate. But as we evaluate, we have to think about what we need to know in the near term and what we need to know in the long term. And we have to think about the question, who is it we have to convince? And this brings us back to the first issue that we raised this morning on the role of evidence in leading to change in conviction and action. So we're going to have to deal with it in education just as we are dealing with it on all of our science policy advice. And finally, a number of the sessions raised core questions about the culture and values of the health professions, and particularly this matter of the heroic physician, or the balance between the values of autonomy and independence in contrast to responsibility and teamwork on the other. Interestingly, I think technology may actually, over time, help undermine the autonomy of the heroic physician. On Friday night, one of the NACFE Communications Awards was for a NOVA program about the smartest machine in the world. That was Watson, that defeated the National Jeopardy champions. Now I ask you, if we can today have a machine that does better at Jeopardy than the best human players of Jeopardy, how long will it be before we have machines that will do better at diagnosis of, you name it, infectious diseases, immunology, cardiovascular disease, right down the line, that is better than our very best clinicians today, or at least rivals them? And if you as a clinician can tap into that machine, why can't your patient? And so the demands that it's going to make on us thinking about the roles of the clinician in relationship to our patients as well as to one another are going to be dramatic. It's not simply teamwork amongst the professions, it's going to be new relations between doctors and patients, health professionals, communities, knowledge, and practice. All of these are in play. All of these are part of transforming health professional education. All of these are part of the challenges that we as individuals, as health professionals, as scientists, as those who care about success in health, all have to work on individually, and I hope through the Institute of Medicine together. It's been a marvelous day. I want to acknowledge and thank once again the committee that helped us in planning today's activities. Specifically, I want to thank Nancy Adler, Sheila Burke, Victor Zhao, Martha Hill, Phil Pizzo, William Stead, Judy Salerno, and Lauren Shern. Thank you so much for a wonderful, wonderful program. As everyone who's ever organized a meeting knows, these just don't happen without an enormous effort on the part of many, many staff people who have supported not only the development of the meeting, but all of our activities through the day, and also all the activities through the weekend, the section meetings, the interest group meetings, the gathering with the policymaker dialogue with Tom Daschle on Sunday morning. And I want to acknowledge and thank our staff who've done so much to make this whole program a success. Judith Shamir, Donna Duncan, Zamika Stewart, Jamal Samuel, Shirla Allen, Raynell Bradshaw, Morgan Heller, Clyde Bainey, Catherine Bothner, Karen Lumbu, Lauren Tobias, Abby Meltzer, Martin Cavani, Claire Flanagan, and a host of other volunteers, including and especially our help from our web-based teams and our AV support. Thank you all so very, very much. And now it's my great pleasure to invite one and all to a reception in the Great Hall. It's been a wonderful gathering. Thank you all so much for being here.